All right, I want to thank everybody for joining us today. We are doing these webinars on Tuesdays and Thursdays at 8 o'clock. We are now kind of focusing on reopening and what's next. On every slide, or most every slide, I actually have my information in the bottom right-hand corner. I've been an emergency medicine physician now for 30 years. And this is my fourth pandemic. I've also helped with a mass shooting and one Category 5 hurricane. So I do a lot around disaster planning, clinically, also how do communities prepare, how do businesses prepare, etc. I also have the Twitter account, AskDrV. And a lot of the research that I'm going to actually talk about today, the original content is on my website, AskDrV.us. All right. So the structure of the webinar is going to be a slide presentation that is about 15 minutes long or so, and then a Q&A following, which is about 30 to 45 minutes. So we usually end by 9 o'clock. And the presentation will pretty much stay the same for the month of May. We do update the slides when new information comes up. And then in June, we'll see what we're dealing with next and kind of set the presentation so that we can kind of guide people throughout this entire pandemic. During the presentation, everyone's in listening mode. To ask a question when we come off, you'll just go to your chat box. We'll have everyone ask questions in the chat box. If there's, less than 15 or 20 people or so on here, then we might even be able to open up the phone lines. So the intention is the webinar is to really keep everyone informed on COVID-19 science that will help them and their families stay safe during this pandemic and sort of navigate and make the decisions that you actually need to make on a day-to-day basis. The outcome that you'll be motivated to create an action plan for yourself and your family, your community, or your business. And usually once people create an action plan for themselves and their family, they begin to then more think about their community or their business community. So let's first about COVID-19. This is really spread around people and surfaces. So it's small droplets from the nose or mouth when somebody coughs, exhales, talks, sings, sneezes, and then these droplets land on surfaces that you touch or it may land on you. And then you either touch your eyes, nose, or mouth and can become infected. I always tell people to respect COVID-19, and the main reason is it's highly, highly contagious. So that is calculated in two manners. One is, what is the minimum amount of time that you have to be exposed to the virus to infect others? So for COVID-19 is 45 seconds. And then the second thing that looks at contagiousness is what is the percent penetration? So if you had 100 people who were exposed to COVID-19, how many of them would get it? For COVID-19, it's 60 to 80. Just as a comparison, for something like the flu, which is influenza A or influenza B, it's 20 to 30%. So it's almost 3 times more contagious than the flu. The droplets are on surfaces and they stay on surfaces for long periods of time. So cardboard boxes, the surfaces can, the virus can last 24 plus hours. Plastic or metal surfaces, the virus can last 96 plus hours. So this is significant to take into consideration when you actually start looking at opening up businesses and what actually needs to be done. So this just kind of shows, you can kind of see how far droplets can actually spread. Now, COVID-19 is acting a little bit more like measles than Ebola. So it's spreading further and faster. And if you can imagine all of the surfaces that are in this trajectory, right? And if they're metal surfaces, how long before someone comes along and cleans them? These are all the things and the factors that sort of need to be considered. And it's not just coughing or sneezing. It just could be regular talking or singing. So I wanted to talk quickly about proper hand washing because there's a lot of stuff about hand washing and most people only do step 1. And proper hand washing actually involves all of these 8 steps. So step 1 is a palm to palm hand washing, which most people normally do. To properly wash your hands, though, you also need to wash between your fingers, which is step 2, the back of your hands, which is step 3, the base of your thumbs, which is an often missed area, which is step 4, the back of your fingers, which is step 5, underneath your fingernails, which is 6, washing your hands includes your wrists, and then also rinsing and wiping it dry, because wet hands that are not fully dried will always pick up more material. So you want to make sure to dry your hands. So these are sort of the 8 steps. And I want to show sort of what it looks like when this is not done. So on these slides, white is what it looks like, or in the first slide, this is what it looks like before any hand washing in the upper left-hand corner. If you do a rinse and shake, you'll see number 2 is what actually is the outcome. 6 seconds of hand washing with no soap, because it's important that you have soap. Number 3 is the outcome. Number 4 is 6 seconds with soap. Number 5 is 15 seconds with soap. And number 6 is 30 seconds with soap. So as you can see, our recommendation is 20 seconds with soap. So you're going to be somewhere between number 5 and number 6. So it really does make a difference when you actually can see the actual particles actually on your hand. Social distancing. The way we were living before all of this happened, one person would infect 406 people in 30 days. That's why it's really important that as we begin to actually look at reopening, that we don't get lax on the hand washing and the social distancing and the wearing of masks. 50% less exposure, one person then infects 15 people in 30 days. 75% less exposure, which is sort of the lockdown that we're in now. One person then infects 2.5 people in 30 days. Now, what are the symptoms? I think what's important about COVID-19 is there can be no symptoms. So there is asymptomatic transmission. We will actually talk about that. That's why it's very, very important around testing. We are currently not testing asymptomatic people, but we need to before we're ever going to get control of this. One of the early signs is sudden loss of taste or smell. And some people actually may just say they don't have an appetite. One of the other symptoms is nausea, vomiting, and diarrhea. We're also seeing a lot of blood clots, deep venous thrombosis, clots in their lungs, pulmonary embolisms, strokes, those sort of symptoms. Then you also have the respiratory symptoms that you hear about: headache, fever, achiness, dry cough, difficulty breathing. The one thing that you find about the difficulty breathing is that some people actually don't experience themselves as being short of breath, but they actually are hypoxic. And hypoxic means your oxygen level is low. So we call them happy hypoxic people, because they're happy, they think everything's fine, but you put them on the pulse oximeter machine and their pulse ox is very low. So that is leading to a lot of people seeking treatment much, much later in this disease. Then the last symptom is COVID toes. I'll show you a picture of that. That is basically a reddish bluish discoloration of the extremities. This is particularly prevalent in kids and sometimes is associated with other symptoms in kids that we're seeing that is sort of like a vascular presentation. All right, so asymptomatic transmission. I just wanted to just show a couple of slides on this. The Theodore Roosevelt found that 60% of their cadets or Navy cadets were asymptomatic. Iceland found 50% were asymptomatic. Cook County jail has been finding about the same, about 40 to 50% asymptomatic. They found the same thing in Voie, Italy. So the asymptomatic transmission has been proven in enough settings that we're clear that that is occurring. We're just not testing the asymptomatics. Now let's talk a little bit about risk factors. Born on or before 1955, and that is anybody who's 65 years or older. In New York, they were really seeing a spike in people requiring hospitalization at the age of 51. Living in a nursing home or long-term care facility, any sort of chronic lung disease, moderate or severe asthma, heart disease with complications, anyone who's immunocompromised, that could be cancer treatment, HIV, rheumatoid arthritis, lupus, sarcoid, any sort of underlying medical condition that's not well controlled, renal failure, liver disease. Pregnant women in general are known to be at risk for severe viral illnesses, but they haven't specifically tested or looked at that in pregnant women, but because of their vulnerability to viral illnesses, they're also an important risk group. And then severe obesity of any age. And specifically, that is a BMI greater than or equal to 40. So a BMI greater than or equal to 40 is 5'2" over 220 pounds, 5'6" over 250, 5'10" over 280, or 6 feet and over 300. So that is a BMI over 40. So other important risk factors. Men are at a higher risk for getting the disease, about 38% more likely to get the infection. And they have a 65% higher death rate. So they're more likely to get it, and then when they get it, they're actually more likely to be in the ICU, be on a ventilator, and actually die. If you actually look at a lot of the pictures when they show on TV, a lot of the people in the ICU, you'll see a lot of men in the ICU. They've also found that people with blood type A seem to be more vulnerable to COVID-19. They're not exactly sure what that is. It could be the proteins on the outside of the blood, but they're more likely to get the disease and also more likely to do poorly when they actually do get the disease. Blood type O has a significantly lower risk of COVID-19. And again, it hasn't been determined exactly why. Smoking and vaping is a really big issue. We have a lot of young people that are actually hospitalized between 20 and 54. About 40% of the COVID-19 patients are young patients in America. And we think that we're seeing this because of the smoking and vaping rates. I'm recommending that people, if they're smoking or vaping, that they actually quit now because they do also have a poor outcome. Now, what's next? Let's talk about what's next. I think it's important as you actually look at what's next that you actually begin to risk stratify things. So specifically, if you're going to do a risk stratification on activities, okay, high risk activities would be public transportation, airline travel, going to restaurants or movies, or going to a work cafeteria or break room that's enclosed, right? I'd also probably include in high-risk activities, a nail salon or any sort of personal services that you're going to get. Medium activities would be a ride share, using an Uber or a Lyft, picking up any sort of takeout food or groceries or any sort of curbside retail. Even medium risk, I'd put in eating outside at a restaurant. You lower your risk by about 90% if you dine outdoors as opposed to dining indoors. Low risk activities, taking a walk, bike riding, going to the park, having food delivered to your home, telework, conferencing, bringing your own lunch or snacks to work and then eating outside by yourself, those sorts of things, right? So that just kind of gives you an idea of the things that you kind of do on a daily basis and how you might want to actually change what you actually do on a daily basis. Now, I think it's very important that employers risk stratify because there's the jobs and then there's also the employees. And in this setting, it's very important because the employer and the employees really need to work together in this. I think the more that you create an environment of teamwork, the more you'll see the companies that create a culture of teamwork are actually going to be the ones that are actually more successful in this. So let me go over a couple of things. So one, there's risk stratification of the jobs, right? So these are categories here of types of employment settings, but inside each employment setting, you also have high risk and low risk jobs. So high risk jobs are manufacturing, obviously, because of all the metal, the close quarters, armed services, any sort of public facing business. But when you get into manufacturing, there could be low risk jobs inside a manufacturing plant or higher risk jobs inside a manufacturing plant. Medium risk jobs would be something like office work, and low risk jobs would be anyone who's in parks, recreation, landscaping, construction, those types of situations. So what is PPE? So a lot of people sort of ask me, and is it really needed? It really depends upon what your actual workplace or work setting is. I think it's very important for employers to actually develop an actual plan that they're communicating with their employees. I have been for some companies helping them develop that plan, and for other companies, they have a plan and I've just been reviewing it and actually showing them how they can actually make it a little bit better. But typical PPE would be your medical mask, gloves, gowns, hazmat suits, goggles, face shields, aprons, etc. What's really important about this, we use a lot of PPE in the hospital setting. And in New York, they just released numbers today that hospital workers who are actually in contact with COVID every day at work have a lower infection rate than the general public. So you can actually, as an employer, you can create what would be considered a higher risk work environment. You can create it into a low risk work environment, depending upon how you actually structure your occupational health plan. This just shows a picture of all of these things. So most people have seen them on TV. Then there's sort of like, what sort of things do you want to ask your employer? One, can I work remotely? If the answer is no, and you feel like you have risk factors, you may want to consider getting a note from your doctor. We've had people on this call who've done that. Some people may want to know, what sort of personal protective equipment am I going to receive when I come to work? If I wear my own personal protective gear, am I going to be able to keep it on at work, or is somebody going to ask me to take it off? Can I get COVID tested at work? How do I get COVID tested? How do I get COVID tested if I feel like I'm sick? Do I have access to telemedicine services through my employer? What is the company policy around a sick leave if I have to be quarantined? So these are all, important things to ask an employer and to actually get the answer to. And on the employer side, it's very important to actually be prepared for the answers of these things in your occupational health plan, so that you've actually got something set up that you can communicate very clearly to the employees. I think in general, no one is expecting a no risk environment, but people are expecting that there's some care and consideration taken as far as their health is concerned. All right, and with that, we're going to turn it over to some Q&A.
All right. Oh, look, we have a fancy new slide for our Q&A. That's so cute.
Yes, yes.
Okay, so we have one, one comment says, just a note, there's a slide, I think it's the one where you start talking about the risk factors. It seems like it was blending or superimposing two slides into one.
Okay.
Yeah, so we'll make a note of that. Thank you. We will make a note of that for next time.
Okay.
All righty, so the floor is open for questions. We have a number of people on the line, so we're going to take questions through the chat right now, and then if we need clarification, we may open up the mic, but we'll go to the chat for now. You can also use the Q&A box, which is located at the bottom of your screen, but I'm going to start at the top and work my way down. But either the chat or the Q&A, we'll take questions there. So let's get started with the questions. All right. Can you provide some insight on the following risk level, high, medium, low, for the following activities as things start to open? The first activity, walking with a friend, mask on, and 6 feet apart. High, medium, or low?
Low.
Okay. Children playing together, adults standing apart, maybe like neighbors.
Medium.
Okay.
The thing with this, so let me just say this. The thing with children is that they just don't, they don't really remember to social distance. So if a child is playing with someone that he's already in the home with, that would be considered low. But as soon as you said neighbors, then that is actually, that's more of a medium. I would try to stay away from that if you can. If you have older children where maybe they're, 12, 13, 14, they really understand how to keep 6 feet distance and keep their mask on. But when you have young children, they're like 3, 4, or 5, you just can't expect them to socially distance. I mean, they're impulsively going to have fun and, grab or hug somebody or whatever it may happen to be. So, so for older children, I would say maybe it might be okay, but for younger children, no, it'd be a medium.
Is there some kind of precaution that you would advise for children playing together? I mean, I know that's kind of, I don't know.
If it is young children, like less than 5, I would actually not do it.
Okay.
I know it seems kind of harsh. Until this is over, I really wouldn't do it. I know that there's been a thing called quarantining, where I've been on quarantine, you've been on quarantine, we've been responsible, so now we can get together. So they found in China that that's actually how they wound up having a lot of COVID deaths in clusters. And it was clusters of either friends or families that actually then decided to get together and during quarantine. So there's been a lot of literature on that, so I wouldn't really recommend it.
Note from Philip. Nice presentation. Thank you. Well, thank you for the feedback, Philip. We appreciate that. And you can add other questions or comments in the chat and we will read them. So, there's one more activity for the high, medium, and low. Sitting at an outdoor cafe / restaurant with someone I live with.
So I would put sitting at an outdoor cafe as medium. With somebody that you live with, I would put that as medium. In order to make it lower, what I would do is I would make sure that I had either my my disinfectant spray, and I make sure that I clean the table and I clean the chair, just where I'm going to be putting my hands. And the main thing with a restaurant, the dirtiest part of a restaurant is the menu. So you want to make sure that you don't take a menu. What I do is I just pull them up online and look at the menu on my phone and then order what I want to order. So there are ways that you can make something like a restaurant less risky.
Is it better inside or outside?
Definitely outside.
Okay. Yeah. All right. Next question. As people get sick now, are things we know about COVID? As people get sick now, are there things we now know about COVID that help with recovery?
Yes. So there's a couple of things that we now know. So one is that when people are having problems breathing and they're getting the COVID viral pneumonia, it's very important to turn them over onto their stomachs. And that's before or after they wind up being on a ventilator. So laying on your back, and usually someone in the hospital lays on their back, is not the best. So just turning someone over onto their stomach actually makes a huge difference. The other thing that we're finding is that if we can avoid putting someone on a ventilator and kind of get them through with sort of, other adjunct therapies, then that works better. The death rate, once somebody is on a ventilator, about 80% of the folks on a ventilator die. So it's very high. The other thing is plasma therapy. Plasma therapy has been very, very effective. And that's basically where someone who's had COVID-19 has donated their plasma, which has some of the antibodies in it, and you transfuse that into another patient. So that's been very, very successful in helping people get off the ventilator.
So we have a question. If you are asymptomatic, how long will you stay asymptomatic? Will it be the same?
So what you're bringing up is what we call the difference between, so there's some people who are asymptomatic and transmit the disease and they never develop symptoms. Then there are some people who are asymptomatic, transmit the disease, and then eventually do develop symptoms. So we call those patients pre-symptomatic. So you're asking how many of the asymptomatic people are asymptomatic and never develop the symptoms versus how many of them actually do develop the symptoms. We don't know the answer to that yet. Mainly because we haven't been able to do the testing.
All right. And this is, follow-up question to an earlier. Why is that quarantine teaming resulted? It jumped. Why is that quarantine teaming resulted in more positives if both parties are practicing social distancing? For example, say neither have been out of their homes for over 3 weeks.
Yeah, so good question. So one of the things is we're seeing people who have not been out of their homes for 3 or 4 weeks who have actually come down with this disease, right? So, and then the other thing is that they're giving 6 weeks, 6 feet as a guideline, but it's not like this virus doesn't travel further than 6 feet, right? And so 6 feet is kind of like a guideline, like so that we can still move around in life and everything. So no, between those two things, just because they've been inside for 3 weeks, it doesn't mean that somebody is not an asymptomatic carrier in their household.
Okay,
I wouldn't take that
just want to
chance.
make sure that we answered the question with Ron. Was this how long are you asymptomatic? If you find out you are COVID positive, I think. So let's just make sure we answered Ron's
yeah.
question.
So yeah, I want to just make sure. So when you are, so is it a question about how long am I transmitting the disease, or how long you develop symptoms within 14 days, right? So
how long
if
will
you're
a person stay asymptomatic?
yeah.
Thank
Okay.
you,
All
Ron,
right.
for
Yeah.
clarifying.
Yeah. All right. Yeah. So if you wind up COVID positive and you have no symptoms, if you do not develop symptoms in 14 days, the likelihood is that you will not develop symptoms. However, you can still be transmitting it after that 14 days. In Italy, they found that people were still transmitting the disease up to 21 days.
Wow. Oh, wow. That's
That's why.
okay.
That's why I want people to really. Yeah, I want people to really, this whole thing of everybody going back. I think it's really important that we don't relax. You know what I mean? Because you're going to start to see people kind of act like everything is normal. And I think it's just really important that we don't actually, we need to kind of still be very careful.
Yeah, absolutely. Absolutely. All right. So the next question, thank you, Dr. V. There's a daycare center here in North Carolina, and there are babies sitting with the daycare workers, and they continue to not social distance. I saw that the workers had all the kids clumped up together. I actually took a video of it. Is this safe? I think you may have addressed this, but let's get clarity.
So no, it's not. So a couple of things with daycares. So daycares, the best way for a daycare to operate is to have 1 or 2 workers that always work with the same children. So like, for instance, let's say you have 10 children, right? Then you'd have 1 or 2 daycare workers work with 5, and 1 or 2 daycare workers would work with another 5. And then every day you would always have the same group of kids, right? So, and the other thing too is that until you actually get to a point where, and I know in North Carolina, you're not seeing a decrease yet in cases. Until you get to start to the point where you start seeing a decrease in cases, you really should only, at a daycare center, there should only be the kids of the essential workers. If I'm not an essential worker, working at a hospital or at a grocery store or public transportation, my kids should not be in daycare.
As people get sick now, are there things we know about COVID? Oh, I did that one already. I apologize. All right, moving on. There's a lot of information out there about antibody testing not being accurate. Is there a test I should ask for if I'm getting the antibody test?
Yeah, so there's a lot of antibody tests. There's a lot of different ones. I'm not recommending that people get the antibody test because it really doesn't tell you that much. All it's basically going to tell you is, have you been exposed to COVID-19? People think that because they catch COVID-19 and then they have an antibody test that shows that they actually were exposed to COVID-19, that they have immunity, and that is not true. So what we're seeing with COVID-19 is that people can catch it again. And so we're seeing in the second wave in China, people who had it and now get it for a second time. So it's important that just because you had COVID-19 does not necessarily mean that you have immunity. You have the antibodies that might help somebody else, but you don't have like lifetime immunity. And I suspect whatever vaccine we have, it may be a vaccine that we have to get it on a regular basis. I don't know. Do you know what I mean? Almost like the flu vaccine is only good for a year, right? There's certain vaccines that aren't lifetime. I wouldn't be surprised if the COVID vaccine winds up being similar.
Makes sense. Makes sense. Is there's a lot of I don't hear much about home health care. I work for an elderly woman. However, there are only 3 people going in and out for 4-hour shifts at a time, and we are wiping down surfaces. Is this high, medium, or low risk?
The question is, you're wiping down surfaces. Are you wearing, are masks being worn?
I'm not sure. I'm not sure. Yeah.
Okay. I would say that
doing. Why don't we answer it like that?
Yeah. Okay. All right. Yeah. So if you're actually doing a home health and you're always going in and you're taking, so here's how you make it safer. You're always going in and you're always taking care of the same person, right? Because if you start doing home health and you're taking care of this person, then this person, then this person, then you're increasing your risk, right? So you're always going in, taking care of the same person. You wipe down surfaces, wash your hands, and wear a mask. It's good if both people can wear a mask, but sometimes sometimes depending upon the clinical status of the elderly person, they may or may not be able to wear a mask. But it would be important that both people wear a mask if possible.
Yeah. So Jeanette, she's giving me additional information in the chat and saying that it's a dementia patient. And right now they aren't able to wear a mask as it's making them anxious. They're trying.
Yeah. So then what you do is you'd have to wear a mask. So what I would suggest in a situation like that, where you're dealing with a dementia patient, is that you actually get one of those, one of the N100 masks. And then that way you're protected completely. And that's what I would do in a setting where the other person can't wear a mask.
All right. Thank you. All right. Is getting coffee from a walk-up window or ice cream high, medium, or low risk?
I'd low.
Good. Yay. I can go get my later. My favorite little summertime treat.
I know, right?
If I'm on a walk and a dog comes up to me, or I see a friend's dog, is it okay for me to pet the dog? Or if I'm a dog owner and go for a walk and someone does pet my dog, how do I sanitize my pet? Good question.
Yeah, so you don't necessarily have to worry about sanitizing your pets, even though pets are getting, some pets are turning positive. Animals have immunity to coronaviruses. So we haven't found anything where there's been any animal that has gotten ill with the coronavirus. It's more humans, we don't have the immunity. So I would have, less of an issue if somebody pet my dog. I wouldn't really, that would be fine with me. I think the interaction I stopped my dog about 2 months ago from going to a dog park, because if somebody's in a home and they have an owner or somebody that has coronavirus, it can be carried in their fur. So I didn't want my dog interfacing with another dog that might carry COVID in their fur. So I don't allow too much dog-to-dog interactions. I don't go to the dog park anymore. Just my dog and I go walking. But if somebody pet my dog, I wouldn't be concerned about that. And I wouldn't pet anyone else's dog, though. I wouldn't take that risk.
You're like, no one else's dog. When do you think we'll be able to test the asymptomatic people in addition? Why is it taking so long to get enough tests?
Yeah, so one of the things is that the president has not use the Federal Defense Production Act for the swabs, for the cotton swabs, and also for the reagents. So the Federal Defense Protection Act actually, makes those businesses, basically any business that could do that, which would be, all of the sort of toilet paper businesses, that's what makes them actually focus 100% on generating the swabs. And so it's a mixture of the swabs and the reagents. And, I personally think he doesn't want his numbers. If you test more people, the numbers are going to go up. And that's just, so when you see certain countries on that John Hopkins dashboard and you're like, Africa or Brazil doesn't have a whole lot of cases. Well, they're probably not testing a whole lot of people, right? So the more you test, the more the numbers will go up. So he hasn't done that. And because of that, we don't have the swabs and we don't have the reagents to actually test and really figure out what are we actually, what are we dealing with? Where are the hot spots? It's almost like flying blind. You decide to fly blind and not see where everything is,
So Brian shares a comment with us. Actually, not a question, but an add-on. Not only are the menus easily transferable for the virus, so are the salt and pepper shakers.
Yes.
Touched by anyone who's seated at the table for the day, along with the staff who puts it out, takes it back at the end of the night into the restaurant. There may be different staff members as well who perform this task. Yuck, LOL. Yep. Thank you for that insight, Brian.
Absolutely. All the ketchup, the ketchup, mustard, salt, and pepper. Yes.
Bring your own condiments in your purse like my mom used to do. With a little hot sauce bottle. I was asked to participate in a COVID-19 research study where they would send the participants a test to test ourselves for the virus. However, I declined because I don't trust doing research studies anymore due to becoming more educated on the history of research and experimentation of Black people, Henrietta Lacks, etc. Would you suggest participating in these studies?
So, I'm very careful around that as well. I think a study where I actually maybe did like a home test, I would do that. These folks who are actually signing up to take this vaccine before it's been tested on any humans, I would not sign up for that. I suspect that even when it does get approved, when the vaccines do get approved, they're going to run it through the process pretty quickly, and they're going to try to vaccinate frontline workers first, which would include myself. I'm not going to be the first to run up there and go get the vaccine. I'm going to let other people. I'm going to, my philosophy is don't be the first, don't be the last. Try to be somewhere in the middle. But I don't necessarily do experimental protocols unless I felt like I had something that was, if I had cancer that was inoperable or something like that. But the home health test, there's no real risk to that. I mean, they're not giving you any particular medication. Those are the studies that I'm more concerned about.
Makes sense. Okay, I want to stay with this. Follow up to the dog question. Why are you not concerned about someone petting your dog? If someone has COVID on their hands and your dog comes to your house, it's okay to have them in your house without concern. Asking because I live in a city and I see friends and my pup friends around and thought about wearing gloves to pet them if I see them. And when I get a dog, I want to make sure it's okay. I don't bring him into my home.
Yeah. So, I was just saying, I mean, it's not a zero risk thing. It's just a low risk thing. Like that person would actually have to have COVID-19 on their fingers and then pet your dog and then transfer that back out. It's just a lower risk thing. It's not a zero risk thing, but it's just a lower risk.
All right, thank you. Let's see. All right, going back here. What about things like pre-diabetes or fibromyalgia or IBD or things like that? What kind of risk factor are those?
Yeah, so IBD is inflammatory bowel disease. And Crohn's and ulcerative colitis. So, what was the other one? Fibromyalgia.
And IBD. IBD.
IBD and fibromyalgia. Okay, all right. So they haven't actually, I haven't seen anything on those as being risk factors. However, you know, IBD does have a component of it that is immune compromise related. So you have to, we're getting our research from like China and Italy. So sometimes there might be diseases or illness that are not as prevalent in their communities. Like for instance, the whole thing around, I think some of the stuff around the obesity, we didn't really see till it hit Italy, right? Because there's not as much obesity in China. So, but I haven't seen specifically anything on IBD or fibromyalgia.
Okay. Oh, and pre-diabetes. That was the other one.
Yeah,
Pre-diabetic status.
yeah, yeah. So pre-diabetes, it really kind of depends upon where you are with that. If you're pretty well controlled. So what they found is with diabetes and high blood pressure that's well controlled, there was less of an increased risk.
Okay. I know I got a question earlier about having one of my relatives is being transferred out of a hospital into a skilled nursing facility, and they're very
Yes.
concerned about that. Does that have the same risk as nursing homes? What are some of the
Yeah.
precautions people should take?
Yeah. So when you think about, I know there's a lot of talk about nursing homes, but it's really not nursing homes. It's anything where people live together. So that's why the universities, the dormitories emptied very quickly. Navy ships, correctional settings, at skilled nursing facilities, rehab units, foster care places where maybe there's a lot of people living under one roof. So anything where there's sort of a lot of people in close quarters or close contact together. So yeah, so a lot of times with the skilled nursing facilities, what's happening now is they're often doing COVID testing before the person goes to the skilled nursing facility. I know in certain jurisdictions like we're doing COVID testing before they go to prove that they were not before they got there, right? And then they are releasing or should be releasing information. Do they have any COVID? You know, what is their policy on testing? Some of them are also not allowing visitors.
Mm-hmm. We're seeing a lot of, I'm going to the next question. We're seeing a lot of, as people are coming out of the shelter at home environment, some of the things that they're suggesting that they do at workplaces is take people's temperatures. How effective is that? And what does that provide any level of protection really?
Yeah, so temperature screening is important. I think part of it depends upon what you have to use a pretty low threshold. So, you know, some people are using a higher threshold, like they're letting people through as long as they're, you know, not 101. You need to use a very low threshold, like 99.6. So again, with all of these things, it's how are you doing it, right? And so, but no, the temperature screening and also the symptomatic screening where you're asking of them if they've been sick lately, if they've had any sort of a fever, cough, nausea, vomiting, that is important to do. I think all workplaces should be doing that. The issue is, what is the incentive for me to actually tell you the truth?
Right.
You know what I mean? If I am sick and you send me home, do I get paid? Right. Because if people don't have sick days, and I think this is, something for us to kind of look at as a society. If people don't have sick days, they're going to come on to work. They might even take some Tylenol before they get there so that way they can pass the temperature screening. Right. And so, sometimes people are really motivated by what their own personal need is to keep food on their plate.
Are there some key things that you would recommend to employers, especially small businesses that are anxious to provide to open, to be able to make, to earn money? And are there some key things that they could do to be safer than not?
Yeah. So one thing is the temperature screening. And then obviously if you're a public facing business, you can require anyone who comes into your establishment to actually wear a mask. And if they don't, they give them one, or if they don't come in, right? And so, I think that, a lot of what you do to be safer as a small business kind of depends upon what sort of business are you, right? And so that's how come I actually work with some of the businesses to kind of set up a plan that's specifically geared towards what they do. But in general, everybody should be temperature testing with the infrared thermometer, checking for symptoms, and they should also be requiring mask for any patrons that come in. Now,
all right.
Depends on what type of business, kind of depends on what sort of mask you need, but everybody should at least have a mask.
Right. Is it safe to go to the doctor's office for regular checkups and etc.?
Well, let me tell you something. I don't know too many doctor's offices that are opening up.
Yeah.
I don't know. Seriously. I tell people, I say, if you want to know whether or not this is safe, one of the things to look at is, does your doctor agree to see you? Most of them are not. Most of them have converted onto telemedicine. They're seeing patients using telemedicine, so that they're not actually going back into the offices. And just the fact that the physicians want to open up just like everybody else and make money, but the fact that they're not, it should tell people a lot.
Okay. A second part of the question about getting sick now with COVID, are there things we know about recovering at home, things to do better, using Tylenol, hydrating? What are some things that you do in recovering at home?
Yeah, so the World Health Organization did come out and say Tylenol, that the Tylenol was preferred, and then they withdrew that. I still tell most people to stick with that. They felt like that ibuprofen somehow or another made the disease a little bit worse. So we are telling people, if they're doing this at home, Tylenol only. Also, to have a pulse ox, a little finger pulse ox you can buy on Amazon for about $12 or so. So that way you can check your oxygenation, and if it's low, get in to get treatment early. And then
what
outside
is
of that,
low oxygenation? What would that number be, just so for people to know?
Oh, that number would be like 92. If you're not a smoker, that would be like 92, 93. Right? Normal person who's not a smoker has 99 to 100% oxygenation, maybe 98. But, certainly if you're getting less than 95, you'd have to be concerned why, if you're not a smoker.
Okay, makes sense. And then on a previous call, you made some recommendations for some natural medicine things and some herbs and whatnot. Could you repeat what you recommend from a naturopathy standpoint?
So there are some studies that are showing that zinc supplements help with this, and that zinc may block some attachments of the virus. So that was one of the things that I recommended, was zinc supplements on one of the calls. I actually, for myself at least, I actually just contacted one of my Chinese acupuncturists. She has a tea that I drink twice a day. I drink like 4 ounces of the tea twice a day. So some people are into Asian medicine, Eastern medicine, and some people are not. I personally, I use it as an adjunct to other things that I do. But the thing that has really been proven out has been zinc.
What about black seed?
I haven't seen anything around black seed being. Okay. Yeah, I do take I personally take black seed oil for other reasons. Yeah, I take black seed oil for other reasons. So I don't necessarily, but I haven't seen it in connection with COVID-19.
I was on the phone earlier with one of my girlfriends, and she asked the question that I told her I would ask you, and that is, she's concerned about should we also have a plan for if we get sick, like
Yes.
deciding which hospital to go to. What are some of the factors that we should look at when picking a hospital? Some hospitals may be better than others. I don't know. And
Right.
then like what you're there on your own. So what should you include on maybe a patient advocacy, because you won't have people there to advocate for you?
So very, very good idea. So one thing is you should be really clear on a couple things that everybody should have a conversation now about. If they got sick, do they want to be put on a ventilator? Do they want to be resuscitated? Because one thing about this disease is clinically it moves very fast. So people go from very sick to very ill quickly. So you want to be clear about your own medical decision making and make sure that husband or children actually know what your own personal wishes are. For some people, that also includes, some people have put together, do not resuscitate orders if they're elderly and they don't want to be on a ventilator and they don't want to have certain things done. The other thing is that I would also make sure that you have most of the over-the-counter medications and the things, if you got sick, that you have them actually at home. So you've got Tylenol, you've got your thermometer, you've got your pulse ox, you've got some zinc. You could look at where in your home, if I had to be quarantined for 14 days and I could not come out of a room for 14 days, what room in my home would it be? Does that room have a bathroom? How would I, what should be in the room? I would actually, just think about, where would you do this if you had to actually do this? When you actually go into the hospital, the most important thing that you have when you go in the hospital is your cell phone and a power cord. So that way you can call family members, tell them you're okay, keep them up to date on what's going on. That is really the most important thing, because we are not allowing, most of the hospitals are not allowing visitors. And then you also don't want to use any sort of common phone. Like we used to have a phone, it would be a portable phone, we'd give it to patients. You don't want to use any sort of common phone that somebody else has been talking to. So you want to, make sure to have your phone and your power cord and things like that.
I'm supportive of that. Okay, we have another comment here. Medicaid pays $19,000 for patients coming into hospital. $39,000 if they use a ventilator. Many lives have been lost due to the ventilator being the wrong treatment of care for many of these patients. Any thoughts or opinions on this information?
Yeah, so, I remind everybody that this disease is a disease that has been evolving. None of us saw this disease, before February clinically, right? So the treatment for this disease has been slowly evolving. And so, the normal criteria for ventilating someone, we wouldn't think twice. We just put the person on a ventilator. So we did kind of what we would normally do. It's only now that we're actually seeing the research of actually proning and turning people on their stomach and actually trying to avoid the ventilator at all costs. So I think practices are adjusting now to the medical research as it comes out. We get daily emails with changes in clinical practice guidelines or public health guidelines that have been found to be effective. So I think that, at the beginning of this, we did what we normally do, and we found that wasn't working as well. And I think people are adjusting their practice. I don't think it's money. I don't think it's particularly money driven. Medicare and Medicaid are all paying 20% more than they normally pay for COVID patients to hospitals, because they realize this is this pandemic is, hospitals are laying off. Because they don't really make money off of COVID patients. They make money off of the cardiac cath lab, elective procedures, going to the OR, and all of those things are shut down. So that's basically, so, I said I was going to write an op-ed on COVID may kill your local hospital, right? Because I think there's going to be a lot of hospitals that close after this.
Okay, very good. So, I actually got an email about a doctor's office. Oh, I had this on my brain. I'm glad someone asked this. Okay. I actually got an email about one doctor's office opening up in a limited capacity in DC next week. And a friend's chiropractor is open. I actually know a lot of chiropractors have been open. in Rhode Island next week in a limited capacity. I want my mom to go to an ENT for other symptoms, but only want to recommend it if and when it's safe.
Yeah, so again, you know, I would go to the doctor if I actually, like, if it was something really pressing. So you know, if it was something that was really pressing, I would go. But if it was just a regular checkup, I wouldn't go around now. You know, I'm dealing with an abscess, a tooth abscess that I got, my appointment got canceled with a dentist because she shut down because of COVID-19. And, you know, I've been now looking at, okay, this is something that is kind of pressing that I do want to get in for. But I kind of said I'm going to give it another month or two. So I definitely wouldn't be going in just for a regular dental checkup or a regular, you know, physical checkup. I wouldn't go in for those things.
Do you think the new protocols will make the need for ventilators less? Because there seemed like there's a big panic around getting a lot of ventilators at one point, and we're not hearing that as much anymore.
Yeah,
Is that because of the new protocols?
I think it will make the need for ventilators less. And I also think that they're having these conversations with their family members, and they're actually coming in, like they're coming in and they're saying, I don't want to be put on a ventilator, or I don't want this, or I don't want that. Mm-hmm. So, yeah, I think that, you know, the social distancing made a really big difference, because we were very, very close at a lot of hospitals to sort of where the critical resources become a problem. My concern is that, you know, if we go back and people kind of relax, that the cases begin to come back in again. And, you know, are people going to want to turn it off for a second time? You really don't want to overwhelm the hospitals. And that's the main thing. I know in New York, he actually required that they have a 90-day supply of PPE at coronavirus levels at all times moving forward. So I think some of them are, and then there was also some exchange of ventilators, like the state of Washington sent some ventilators to New York. So there was some exchanges statewide. We now have Ford Motor Company, and I think GM are making ventilators. They did do a Defense Production Act for ventilators. Mm-hmm. So the car manufacturers are making ventilators. So that's also making a difference.
So 2 questions, if we can get them in before we're right at time. If we follow these guidelines and do the best we can, is it possible to get into a new normal swing of things and feel some confidence in staying safe? That's important.
Yeah, I think so. I mean, I have a routine when I go to work. You know, I have my Clorox disinfectant, and I'm spraying my chair, I'm spraying the table, you know, I'm spraying the computer, I'm spraying the phone. You know, when I go to a hotel, I'm spraying the light switches, because sometimes I have to I travel and I go to hospitals that are not in the Washington D.C. area. So yeah, you can kind of get into a routine and begin to feel, you know, safe and a little bit more comfortable. I know even for myself, you know, I'm even getting better with the Zoom calls and the Zoom happy hours and the Zoom meetups, and, you know, not feeling as isolated, I think is very important. Yeah, I think that, you know, we're going to have to kind of make this our new normal till a vaccine comes out.
Mm-hmm. And last question, if you don't mind, because this one comes from my brother, so I'm taking it. He wanted to ask about the effectiveness of contact tracking.
Contact
tracing. In Kansas City, they're looking at doing a 10+10+10 program, 10 people in so much space, whatever. And they're going to require that we keep track of, what's he saying? Keep track of who's coming in and out of the space.
Yeah. So this is very important for employers, right? It's very important to have a contact tracing set up, if you can, for a workplace. It's a little bit harder if you're a public-facing business, but if you're not a public-facing business, and people are, you know, moving from one area to another, it's good to either have by videotape or ID or GPS, some sort of contact tracing. So contact tracing is actually really important. Basically, when I work in the emergency department, we do contact tracing on all the patient's rooms. There's a sign-up sheet, and I sign my name that I went into this room at this particular time, and I had on my N95 mask, I had on my Tyvek suit, and I had on gloves, and I had on a face shield. So I checked box what I actually was having. So then if the patient turns out to be COVID positive, then they may contact somebody, and they're going to contact first the person that went into that room and maybe didn't have on PPE, right?
What information should we be asking on this tracing?
Yeah, so that's why I said it kind of depends upon the business, right? So so it depends upon, like,
So he has a law firm. That's what he's talking about. That's what he cares about.
Oh, okay, all right. So if you have a law firm and you have a law office, then you might want to put it on the offices, who's coming in and out of this particular office, and you're basically collecting name, date, time, right? And then in a law office setting, people are not wearing PPE, so it's just, are they wearing a mask or not, right? And so everybody should be wearing a mask inside the office. So the other thing is, if you're in an office setting, you really want to look at what sort of filters are being used in your air conditioning system, right? You want to make sure that the highest grade, the antibacterial, antiviral filters are being used in the air conditioning system. So sometimes I tell people, if you have to go buy one and it's $20 for your landlord, buy it, so that way the circulation of the air is filtered to the highest degree. But the contact tracing is for people who are moving in and out of certain areas. So they're moving in this area, and you want to know who was over here at what time. And it's very important in an environment where you have a high risk job, like a manufacturing plant, for instance. They should, on all these meat plants, have contact tracing.
And we have a request with the name of the tea that you mentioned drinking again. We have the
tea that I actually drink is from my acupuncturist in Bethesda, Maryland. She calls it Formula 5, so don't ask me what's in it. But I noticed that a number of the Chinese acupuncturists have been in contact with the Chinese doctors in Wuhan, and in their culture, they go to the acupuncturist and get various formulas and things like that. And so that's why mine is called Formula 5.
And last comment from Janaea. I have a suggestion on the contact tracing. Yes, Rhode Island also started with just asking people to write down in a notebook who they saw each day, and now they're working on an app. Nice.
Yes.
I wanted to suggest that people start doing this on their own.
Yeah, it would be yes, because you'd be surprised how much you forget about something. And then just even on your daily planner, if you actually put, hey, today I saw this person, and this person, that would be important. Yeah, there's a lot of work on an app that you volunteer to be a part of. So you agreed that you're going to actually have yourself traced anonymously. And then if you turn positive, then you click that you became COVID positive, and then it's uploaded to the public health departments.
All right. Well, yeah. I think that's it. Thank you, Janaea. She says, great day, Dr. V and Holly. We appreciate you always, Janaea. I think that's a wrap for us, Dr. V.
All right. Thank you guys for coming. Make sure to check out the website or follow us on Twitter, and give us any comments. If you need any help with anything further, reach out. There's a little form afterwards. You can reach out and send me an email.
Oh, thank you. And we'll see you guys next Tuesday, because we'll be back.
We'll be back. All right. See you then.